Is recognized for 5 minutes.
Thank you very much, Mr. Speaker. First, let me thank Chairman Berman for your leadership and for your commitment to addressing this very devastating public health crisis, humanitarian crisis, and national security crisis. I also want to thank Ranking Member Ross Layton, Chairman Payne, Ranking Member Smith, Chairman Waxman, Congresswoman Donna Christensen, for working together to bring this bipartisan bill to the floor. Our Speaker, Nancy Pelosi, has been such a leader early on in addressing the HIV and AIDS crisis, and without her support, we would not have such an important bill before us today. As an original co-author of both the initial legislation establishing PEPFAR and of this new bill reauthorizing PEPFAR, I'm pleased that today we will complete action on this important initiative and send it to the President for his signature. Each of us has witnessed, as Mr. Berman indicated earlier, the devastation that AIDS has caused in Africa and in the developing world. And we've seen the very dramatic impact of our AIDS programs over the last 5 years in actually saving lives. And this bill will save millions more in terms of life-saving drugs and treatment and care. And yes, to the gentleman from California, Mr. Rohrabacher, I believe that spending $50 billion to address a global health emergency makes more sense than spending over $600–700 billion on a war, quite frankly, that did not have to be fought. Quite simply, by enacting this bill, we will help change the lives of millions of people around the world for the better. This bill is a model of compromise and stands as a testament to what true bipartisanship can accomplish. It's also, let me remind this body, that it's the latest in a long string of initiatives on HIV and AIDS that have been born out of a willingness to work together and put the United States on the right side of history when it comes to this global pandemic. First, in 2000, we passed and President Clinton signed into law the Global AIDS and Tuberculosis Relief Act. This important bill provided the founding contribution and framework for the Global AIDS Global Trust Fund. It was inspired really by my colleague, my predecessor, Congressman Ron Dellums, now Mayor Ron Dellums of Oakland, California, and supported by former Chairman Jim Leach of Iowa. In 2001, working with both former Chairman Hyde and Chairman Lantos, we drafted H.R. 2069, the Global Access to HIV/AIDS Prevention, Awareness, Education, and Treatment Act. This was the first bill that dared to provide a large-scale antiretroviral therapy to people living in the developing world. Unfortunately, it wasn't enacted because we couldn't reach a conference agreement with the Senate. At the end of 2002, the Congressional Black Caucus, along with practically every advocacy group in the United States, sent a letter to President Bush urging him to create a presidential initiative to fight AIDS in Africa. In January of 2003, the President stepped up to the plate and promised $15 billion to fight AIDS during his State of the Union address. Within 5 months, working with Chairman Hyde and Chairman Lantos, we passed H.R. 1298, the United States Leadership Against HIV and AIDS, Tuberculosis, and Malaria Act of 2003, which created PEPFAR. In 2005, we took yet another step forward, and we passed H.R. 1409, the Assistance for Orphans and Vulnerable Children in Developing Countries Act, again with Chairman Hyde and Chairman Lantos and Chairman Berman and Chairman Payne. This bill fine-tuned our programs to meet the needs of children orphaned and made vulnerable by AIDS. So, Mr. Speaker, I lay out some of the history of our work on this very important issue because it speaks volumes about what is possible when we come together in the spirit of bipartisan compromise. It is that bipartisan spirit that is again on display today as we honor the legacy of both Chairman Lantos and Chairman Hyde through this legislation. I am saddened that both of them are not with us, like all of us are, to witness this moment. But I know that they would have been very, very pleased. As I have said, this bill is a compromise. And as in all compromises, each side did not get everything it wanted. But that's what compromise is about. I want to mention just a few important items that I worked on which have been included in this bill. First, it takes language from H.R. 1713, the Pathway Act, to strike the 33% abstinence until marriage and helps address the needs of women and girls in a comprehensive fashion. abstinence, be faithful, use condoms. Comprehensive. It includes language taken from H.R. 3812, the African Health Capacity and Investment Act, to build health capacity by recruiting, training, and retaining health professionals and strengthening healthcare systems. And may I have an additional 2 minutes, please, Mr. Berman? 1 minute. Okay.
Please yield the gentleman an additional minute.
The gentlewoman from California is recognized for 1 minute.
Thank you, Mr. Chairman, very much. I'm also very grateful that the Senate added language that I originally authored in H.R. 3337, the HIV Non-Discrimination in Travel and Immigration Act, to remove this, quite frankly, unjust and discriminatory statutory ban on travel and immigration for people living with HIV and AIDS. I'm especially pleased that we are lifting this statutory ban just prior to this year's International AIDS Conference in Mexico City. As a delegate to the last 4 conferences, I look forward to bringing this good news to Mexico City. While I support the underlying compromise, there are many items that I wish had been included. Eliminating the prostitution pledge loyalty oath, recognizing the public health benefits of linking our HIV/AIDS programs with family planning services, recognizing the need to engage with communities that are at the forefront of this pandemic, such as men who have sex with men and injection drug users, and clearly committing to providing life-saving AIDS drugs to no less than 3 million people. So let me just thank you again, Chairman Berman. I want to thank our staff, especially Crystal Santos of my office, and I'd like to insert for the record or ask unanimous consent to put all of our staff members' name in the record who worked on this bill. Thank you.
Without objection.
Thank you, Mr. Speaker.
Without objection.